Hi everybody, Dr. Joseph Cipriano here, and today we have Mama Cip, my wife. We're going to be doing an adjustment on her, but before we go ahead and get started, just a couple things that I did kind of want to talk about and mention, just kind of fill you guys on what's going on. So we were pregnant with twins. Yes, you probably caught that past tense of were. My wife, she ended up going through a miscarriage, and that is actually how we found out that we were having twins. So obviously a little bit of kind of a shock. We weren't ready for that, but as what God had in his plans, it was not, for this to happen. So, I think for one thing, we should have had her health up a little bit better, from our first child, which our first child is still very young. Just kind of turned 6 months, so she was already ended up having her miscarriage at 11 weeks, so there still wasn't that much time in between. So I know Mama Cip is going to be putting up a video of her experience, correct?
Yep, I will be posting a video about the miscarriage in about a couple of days, just kind of talking about my experience through it and what I've learned and what I would do next time if, God forbid, I were to have another miscarriage.
Okay, so with that being said, it's actually been a hot minute since you've been adjusted, so
yep.
I know this is something that you are definitely going to need. Body's definitely out of alignment. Just been kind of dealing with a lot. Now I know you're telling me the low back, actually almost everything, low back, mid back, neck.
Yeah.
Right?
Yeah,
Okay.
Everything's kind of hurting, but I feel like my low back, ever since the miscarriage, my low back has been killing me the most.
Okay.
So, I don't know.
Okay, so what we're going to do, we're going to have her start, we're going to have her lay face down.
Okay.
Alrighty. So, things that I go to look at when she does go to lay face down, I like to start off, and I'm going to scan the entire body. I'm going to start off even looking down here at the feet when I'm looking at the leg length. So her right leg is about a half an inch short on the right side compared to the left. When I scan up her body, I can tell her body is shifting, kind of shifting over to the right like this. So these are little things that I look at in general. Then I'm going to start with palpating. Palpating just means that I'm feeling into the spine, into the surrounding muscles by it. I'm literally feeling for the symmetry. I want everything on the left side to feel as it does on the right. That's the number one thing with chiropractic. You want that symmetry. You want it the same to be throughout. So as I'm going up her entire spine here, wow, even just that I'm feeling things move.
I know, it's already happening.
Yeah, so as I'm going up, I'm definitely feeling some taut and tender fibers, a lot right here through this mid-back, going up. And now here wow, okay. So a little bit more on this upper part on that left side here, in that upper thoracic area, and then we'll get into the neck. Yeah, neck is feeling a little stiff as well. So these are a couple areas that I'm feeling. Now you are short on this right leg. Let's see here. Any pain on this side when I push in on that SI joint?
Not really that much.
Okay. And we're going to go to the right side.
Oh my God.
Okay. So as we can tell, right short leg, right-sided pain over that SI joint over here. So now what we're going to do, we're going to check the sacrum out. We want to see if it's more of sacral issue, more of a lumbar issue, more SI. So what I'm going to do, I'm going to pressure down on your sacrum just like this, and I want you to raise this leg up as high as you can. Any pain, tenderness, tightness with that?
Yes.
Okay. Now I want you to raise this leg up. Pain, tenderness, tightness with that?
A little bit.
A little bit. What side was worse?
This side.
The right side? Okay. So what I want you to do, I want you to cross your right foot over your left foot. So now what that's saying at home, to let everybody know at home, is her sacrum is pointing more to that left side. So when it's angled more to that left side, what's happening is all the muscles and ligaments are looser on this side compared to the right. So you got to realize, you know, with the sacrum pointing this way, those ligaments are looser, letting that leg raise up and causing less issue with pain, obviously, is what she's feeling. Whereas the right side, what's happening is everything is already taut and tender, and it's restricting her from raising that leg up. So as I'm having you cross that bad leg over the good leg, and then we're going to start with some drops right through here. I'm going to have you just slide down a tiny bit. Perfect right there. So the drops, what I'm going to be doing, I'm doing a P to A drop, which means posterior to anterior, and I'm also going to do a torquing move with the hips here too. So to get that sacrum from this side and bringing it back over here, I'm going to torque in that counterclockwise direction. Good. Perfect. Okay, so I'm going to have you uncross, bend that knee for me. There we go. Okay, so now we're going to stabilize on the sacrum. Raise this leg up for me first. Good. Raise the other leg up for me. What do you notice?
It feels good actually. The tightness is gone.
The tightness is gone? Okay, good.
It's not uncomfortable to do that anymore.
Good. See, little things like that are exactly what I'm looking for. Now, granted, her sacrum may have not been rotated off by much, but that little bit where it was off, you know, was causing that much of pain and tenderness. So, you know, just little things like that, you know, do really affect one's body. So now I'm going to come up through here. I really want to check on, we're going to check on that T1 up through here. Yes, you can come back up a little bit. Perfect. Alrighty. Yeah, good. Good. And we're going to do the other side. This side's going to be a little bit lower here. Perfect. Just a little bit of movement. That's a good thing. Okay. So now we're going to come throughout the, going to drop down throughout the thoracic spine. We're going to come more to that mid-back area. So what I want you to do, I want you to take a deep breath in and let it all out. That was needed. Okay, one more time, deep breath in and let it all out. Perfect. There we go. Yeah, those are definitely needed. I know everyone at home was guaranteed able to hear that. I got some great movement there. Any of you crack addicts would definitely love that. Okay, so now what I want to do, let's have you sit up. Let me take this off first. Hold on. Okay, let's have you sit up. I want to have you sit, face that way.
Okay.
Sit.
I'll sit.
Yep.
Okay.
So we're going to just clip this on up here. And so I want to check your neck here. So first off, I want you to turn your head all the way that way. Good. Turn your head all the way this way. Any issues with that? Any tightness, restriction?
Not really, no.
Okay. Look all the way up. And look all the way down. Any issues with that?
Mm-mm.
Bring one ear to one shoulder, one ear to the other shoulder.
A little tightness with that.
Which side?
Both.
Both?
Mm-hmm.
Okay. So what we're doing here is we're putting her through range of motion. We had her do rotation, flexion, extension, and lateral flexions on either side. So the lateral flexion part was what you were kind of feeling a little stiffness on.
Mm-hmm.
So let's turn. Good. And we're going to come over to this side. Just two
Felt
little
so
ones.
good.
There we go. So that movement, that'll help, obviously, in that neck region.
Mm-hmm.
what I want to make sure at the end, what I want to do, I want to make sure that everything is cleared out though. We're going to use that Y strap. We're going to make sure and get everything completely cleared.
Okay.
But first, what I want you to do is I want to do a standing thoracic adjustment. I want to make sure that the rest of that is cleared out. So I'm going to have you stand up behind over here.
Okay.
And I'm going to come right behind you. Arms out by your side. Good. Hands over mine. Lean back. Elbows together.
That always feels so good.
Yeah, you felt that one, didn't you?
Yeah.
Okay. Good, good. All right, so I'm going to have you sit at the edge of the table right here.
Okay. Oh, did you want this on me?
Mm-hmm. So I'll have you put that back up and on. Good. So now, to everyone at home, what I'm going to be doing, this is called the Y strap. It is a Y-axis distraction, and the point of it is, so what we're going to be doing, we're going to place this around the bottom, basically at the base of the skull, which is called the occiput. So we're going to have the strap around the base of the occiput. I'm going to have her lay down on her back, and I'm going to distract, and I'm going to decompress her spine. So it's a very powerful manual decompression. Now, you may feel this going from, in the upper cervical, going all the way down into the low back, okay? So I know you know, but to everyone watching at home, yes, so that is what you would be feeling. Perfect.
That help a little?
Just a little, yep. And we're gonna lean back. Good. Okay. So here's where, in this position, I'm gonna distract out completely the tension and perfect. Relax for a second. I know that move is very powerful. A lot of people don't understand, the strength behind that move. It just literally, it opens up every vertebra. What it's doing is it takes pressure off the nerves that are exiting out of the spine. When you take pressure off those nerves, it allows the body, to function and heal as God intended. So, this is, these are things that we want to do. The point of chiropractic, when you take the, the pressure off that nerve, we can restore the function in the body. So with this move is it takes pressure off the nerves from the neck, even going all the way down to the low back. So today, we definitely got a lot of movement. How are you feeling?
Oh yeah. Taller.
Taller.
All 5 feet of me.
So anything else that you'd like me to work on? Any other issues or no?
Not really, no.
Okay.
It always feels good when you do the ankles and feet, but no.
We'll get to that one on the next video. But so just to recap, I want to let everyone know that my wife, Mama Sip, on her channel, she will be posting a video about the miscarriage and just talking about her experience and what she went through. It may be a little graphic of a video. Am I right with that?
Just a little bit, yes.
I know you're kind of planning just a little bit, but I don't want to spoil anything.
Honestly, I'm not even sure whether I should put in those pictures or videos or not. If I should kind of soften it, but...
Well, the thing is for all those mothers out there or expectant mothers where if they have to unfortunately go through what you did.
Yeah, I know. I wish I knew how it is having a miscarriage naturally without doing the DNC.
Yep. It's an awful experience.
Yeah.
Definitely don't wish that upon anybody.
Nope.
But life is life. Things are going to happen, and to get people to understand and learn a little bit more about what one goes through and what one experiences. If she can help one other person through it, that would be amazing.
Yep, exactly. Also, weren't you going to mention the new merch store?
Yes. So I am also kind of in the process right now, but we're trying to get everything going with the new merchandise store. Gonna be starting obviously with some t-shirts, some graphic tees. What I would love from you guys, if anybody has any ideas, any funny sayings, anything like that, anything possibly chiropractic, just let me know. I'm gonna, kind of taking ideas. I'm going back through a lot of the old comments, which, granted, I think everyone loves the comments on my page. But I've been going back through those comments and trying to find creative, funny kind of things, about me or about chiropractic in general. And we're definitely going to try to get a real cool spin on this. I can't wait to get this going. You guys will see everything up and running. I have my website now going, www.drjosephcipriano.com. I do have an online store with my vitamins and supplements, so it's through Metagenics, which is a great company. So if anyone was looking, any need for that.
Lots of good discounts through that as well.
Yeah, I have a 20% discount for first-time buyers on there. But yeah, guys, just let me know if there's anything that you want to see, anything, any ideas for designs or for merch. Let me know. I'm all ears with you guys.
Yeah, definitely feel free to comment.
Yes, please do.
Yep.
I'm Dr. Joseph Cipriano. If anyone is looking to, come in, get an adjustment, get scheduled, just feel free. I'm going to leave all the info in the description below, and feel free to contact me. Have a good one, everybody.